helping make your life easier. Moms Every Day.
Hey there, everyone. Thanks for joining us for Moms Every Day. Today, we're here with Dr. Susan Flesher, who is a pediatrician, and today we're talking about spina bifida. So what is spina bifida?
Yes, spina bifida is a birth defect that involves the spine, or what some of us commonly call the backbone. And with spina bifida, the spine doesn't form properly during the first month of pregnancy. There are different degrees. In the mildest form, there is no opening in the skin on the back. But in the more severe form, which we call myelomeningocele, there's actually an opening in the skin on the back, and the spine and the coverings of the spine, which we call the meninges, protrude out through that opening.
Okay, and what causes spina bifida?
Well, in any particular case, we probably aren't going to be able to say exactly what caused it because it's a multitude of different genetic and environmental factors.
Okay.
But one thing we do know is that a lack of folic acid can contribute to spina bifida. So moms that before pregnancy and during the first part of pregnancy get adequate amounts of the vitamin folic acid, which is a B vitamin, they can tremendously decrease their risk of spina bifida. And some moms who have who take medication for seizure disorders, they may have to even take additional folic acid because those medications can interfere with folic acid.
And doctor, what are the special medical needs of the children who end up getting spina bifida?
Well, they're complex. Many children with spina bifida also have hydrocephalus, which is increased fluid on the brain. This fluid, which is called CSF or cerebral spinal fluid, it normally bathes the brain and spinal cord and protects it. But if there's extra accumulating in the brain, as is often the case with spina bifida, then a surgeon would have to go in and put in a small tube called a shunt to drain that fluid out of the brain and into the abdomen. There are also varying degrees of problems depending on where the lesion is on the back. There is nerve damage to the nerves that innervate the lower body. So there may be problems with paralysis or partial paralysis, and also with bowel and bladder function.
So spina bifida causes other complications as well, or it can?
Yes, definitely.
Okay, and are there treatment options available for children who have spina bifida?
Yes. In this area here with Marshall Pediatrics, we have a multidisciplinary Spina Bifida Clinic that meets on Thursday, the fourth Thursday of each month in the morning. And we have several specialists involved in providing the care in that clinic, including a pediatrician, pediatric neurologist, pediatric urologist, pediatric orthopedic surgeon, and we also have physical therapy, occupational therapy, social services, nursing, case management, and orthotics. So it's very comprehensive care that we provide.
And you mentioned that multidisciplinary approach. Why is that approach needed for these children?
That's such an important question because these children can lead such happy, full, and healthy lives. But in order to do that, they need to have all this care provided. As I mentioned, there are a lot of different complications that can occur, so they need a wide range of specialists to help them.
Sure.
And it's much more convenient for the family to come to one appointment and see 8 services than to go to 8 different appointments at 8 different places.
Sure.
In addition to that, it helps the care when you have everyone communicating. You know, when you have the orthopedic surgeon right there, he can communicate with the man that sells the orthotics, and they can communicate with physical therapy. Everybody can talk together and provide the best care possible for this child and family.
Dr. Flesher, if there's anyone who is watching and has a child with spina bifida and would like to get in touch with you or learn more about resources available to them, how can they get in touch with you?
The best way would be to call Marshall Health, and it's 304-691-1300, and ask for information about the Spina Bifida Clinic.
Well, Dr. Flesher, we appreciate you being here to talk with us. Very important information that we've learned today, so thank you. We appreciate it.
Thank you very much. Thanks for having me.
If you all at home would like more information, you would like to get in touch with Dr. Flesher, you can head over to WSAZ Mobile or WSAZ.com. All you have to do is click on the Moms Everyday tab. We'll have this interview and all that information there that you need. Thanks so much for joining us. We'll see you back here tomorrow.